Good afternoon, everyone. Welcome to our last Learning in Action Network. This will conclude our 5-year journey together. This is for the cardiac work, and this is the impact of cardiac work on communities and Medicare beneficiaries. Next slide, please. Want to start off by saying a giant thank you to all of you that have been an integral part of helping us reach our goals and helping to improve the lives of Medicare beneficiaries. Without you, we would not have been able to go as far as we were. You really have had an impact in all the work that we do and everything that we hope to accomplish within the next scope of work coming up soon. Next slide. So this report highlights our proudest achievements and includes details about successes and lessons learned over the duration of the 11th scope of work, which is our current Medicare contract. Next slide. The New Mexico, Utah, Nevada, and Oregon states were the ones that participated in this current scope of work. Our next scope of work, we will have a much broader reach with the combination of Qualis and HealthInsight, and we are now Comagine Health. So as we move into our next scope of work, we will be continuing the great work, but on a much broader scale and reaching more Medicare beneficiaries than we were this previous. Next slide. So currently in the 11th scope of work, many of you focused on some of these tests with us. Some of you may not have participated in, but these were all the different types of education and contract goals that we had. So we had hypertension protocols, diabetes self-management, antipsychotic medication prescriptions, hospital admissions and readmissions, high-risk medication screenings, antibiotic stewardship, quality payment programs, quality improvement initiatives, and improved vaccination rates. And those were just a few of the many contracts that we worked on. Next slide. So when it comes to hypertension protocols, 73% of recruited practices and 78% of recruited home health agencies were able to implement hypertension protocols. And more than 1,060 people received learning on topics related to blood pressure control through our monthly cardiac learning networks. And that's been since November of 2015. Next slide. We recognize that many outpatient practices needed extensive support to improve their electronic health record data extraction process. So these were just some of the key areas that we focused on. We assisted practices in developing sustained methods for tracking their improvement efforts on blood pressure control. We also helped a good number of practices find resources for blood pressure cuffs. We found that that was a great need and lacking in many states for providing a cuff to someone who may not have been able to afford one. Next slide. One overarching intervention was helping practices understand their patient registries and how to use them advantageously. Some practices didn't even know that they had that capability or how to use one. So in learning that, it really helped them understand their patient populations better. Many providers requested home monitoring of blood pressure readings to eliminate white coat hypertension and to confirm hypertension diagnoses. Next slide. To accomplish these strategies, we partnered with 88 stakeholders, including AHRQ, EvidenceNOW, state and local health departments, the American Medical Association, the American Heart Association, and the National Home Health Quality Improvement and Million Hearts campaigns. And I can't say enough for partnering. It has really helped us to not only have a broader reach, but also understand different entities and how they view the measures that we're looking at. So it really does take a great deal of partners and stakeholders to help us not only understand, but to help advance the work. Next slide. EvidenceNOW Southwest is one of 7 cooperatives focused on improving delivery of cardiovascular care in small to medium-sized primary care practices. This initiative utilized practice facilitators and clinical health information technology advisors in primary care practices in Colorado and New Mexico to build capacity for quality improvement, change management, and implementation of patient-centered outcomes. Next slide. So some of the successes and lessons learned from the last 5 years, among the valuable lessons regarding cardiac care process is maintaining strong partnerships with aligned organizations, which can take an initiative farther and faster. Partnering with patients on home health blood pressure monitoring is a great opportunity to engage them in their care. And we found a lot of success and things that we didn't recognize coming from the patient's perspective that really helped us to advance this work. Intervention development should reflect local culture and environment, and updated hypertension guidelines should be integrated with agility. Providers get so used to one type of guideline, sometimes it's hard to get them to switch to something, and it's not always necessary for them to switch. Being that we have so many different hypertension guidelines, it's helping them figure out what's best for them and their patients. Quality reporting changes can be opportunities. Advancement of meaningful use and the quality payment programs have also helped practices focus on population health. Next slide. So at this time, I'm going to turn it over to our state leads to talk about the things that they're most proud of in their state. I'm going to start with Lily from Nevada.
Okay, thank you, Edie. Can you guys hear me?
Yes, we can hear you.
Okay, wonderful. So in an effort to improve hypertension and heart disease management, besides offering our monthly LAN educational offerings, Co-Imagine Health in Nevada partnered with the state of Nevada's Division of Public and Behavioral Health Wellness Program, which is conducted by team-based care members, and it also included the American Heart Association and the Southern Nevada Health District. And together we created the high blood pressure and the stroke resource toolkits. We focused on reducing risk factors as well as prevention education. The toolkit included information from the CDC clinical health worker toolkits, the American Heart Association check change control programs, the DASH diet program, as well as the Million Heart program. The toolkits are divided by provider resources and patient educational information for self-management and prevention. And the toolkits were provided electronically and in print format to our concentrated 22 recruited clinics, which consists of 50 providers. The information provided in the toolkits were carefully chosen as critical interventions for improving cardiac health, and they were chosen based on the quality of their information, effectiveness, and evidence-based practices. We have also provided a presentation on blood pressure protocols and have made it a normal conversation between our providers during our one-on-one visits. Through our partnership, we also conducted a rural outreach campaign. We provided education on March of 2018 for 8 critical access hospitals and rural clinics. And we addressed hypertension controls and protocols, which was then followed up with planned visits to each site to support implementation of the hypertension protocols. We have been able to give out an estimated 200 toolkits, and we hosted 15 different cardiac presentations to providers since the start of the contract, which has positively affected an estimated 120,000 beneficiaries. Nevada's other accomplishment is that we were able to recruit and maintain a recruitment higher than the target with a pattern of increasing participation. We received a lot of positive feedback from providers about the content of the toolkits, as well as the education that was provided in our post-education surveys. Many took the information and used it as their own staff education, and we occasionally get requests for more information and materials. And we also continue to assist in the expansion of the self-monitoring blood pressure program to federally qualified health centers and rural health clinics. This is also true for our home health agencies. Our agencies are recruited from multiple counties across Nevada that serve diverse and disparate populations that cover 8 out of the 16 counties in the state. We have maintained great relationships and retention numbers with our 25 recruited agencies as well. We familiarized our agencies with HHQI and its cardiac registry, which a lot of them did not know existed, and shared similar resources and education with them as well. We provided a lot of one-on-one education on how to use the registry and how vital the information would be for them to maintain, since a lot of the residents would end up in the hospital because of various cardiac conditions. We stressed that this would help to lower their rehospisalization rates, which got a lot of their attention. The challenge seemed to be in re-educating new leadership because the turnaround was high, but we made it a regular practice to follow up with our agencies on a regular basis to make certain that new leadership was engaged in the same way. And because of that, we met our cardio milestone targets. And we are continuing to educate our agencies through email and in-person technical assistance. And regardless of what the 12 scope of work will bring, we continue to maintain our relationships and plan to sustain the education for our partners and beneficiaries, and continue the collaboration in the wellness program as well. And now I'll pass it on to our project manager, Rebecca Bally from Oregon, for their 5-year journey updates.
Perfect. Thank you very much, Lily. So I'm just going to talk about 3 things that we're really proud of at more at a high level here in Oregon. So in Oregon, we actually had 3 organizations provided with federal dollars to work on the ABCS measures and improve cardiovascular health. So one of the things we wanted to do early on was make sure that we were collaborating with them, coordinating, so we weren't duplicating efforts, and that we could really leverage the expertise and the experience that each organization was had. So the one organization was our health authority, the Health Promotion and Chronic Disease Prevention Department. They received dollars from CDC to improve cardiovascular health in the state of Oregon. And then also Healthy Hearts Northwest was a Washington, Idaho, Oregon effort. And I think Edie mentioned the EvidenceNOW Southwest. This was part of that same effort from AHRQ, and they were, Orprin was actually working with several clinics around the state to improve the ABCS measures, and so we wanted to make sure that we weren't just duplicating or asking too much of the clinics we were working with. So I'm really proud of some of our early efforts to do that and leverage best practices. And then really want to celebrate the fact that we met our provider metrics, and I want to thank folks on the call for the wonderful work that you've done to get to that stage. So across our 5 years, we've worked with 52 different practices, and almost 85% of them were using a blood pressure protocol by the end of April of this year. 97, almost 98% of tobacco users were provided with cessation counseling among those recruited practices, and just 73% of hypertensive patients had their blood pressure adequately controlled, again, by the end of our efforts together. So really want to celebrate those wins, and we continue working on sustainability with those partners. And then the last thing I just want to raise up and congratulate and celebrate our folks that we worked with in home health settings. So we worked with 12 home health agencies over the course of this project, and 11 were using a blood pressure protocol by early May of this year. And as you can see in this graphic, many of them were able to meet at least cardio milestone 1 from the HHQI. And we continue to provide monthly updates with resources and tools and encouraging folks to access some of those resources. So those are just the 3 high-level things I just wanted to celebrate, and thank you, the folks on the call, for all of our work and partnership together over the past 5 years. And I hope that we will be offered an opportunity to continue working together over the next 5 years. So with that, just want to say thank you, and I will turn it over to the other Rebecca, Rebecca Wilson in Utah, our regional multi-state lead for this work.
Thank you. And similarly, I want to share some of the highlights of what came out of the work done here in Utah over the past 5 years. And kind of our biggest accomplishment, the thing that produced the most resources and ways to help our community, was our active participation in the Utah Million Hearts Coalition. Similarly to Rebecca Valley in Oregon, we learned early on in this contract and in this work that there were several other entities doing similar work and trying to accomplish a similar mission. And so we partnered together, formed a coalition, and I'm proud to say really hit the ground running with that group and got a lot accomplished. We started out looking at the accuracy of blood pressure measurement as our first step, and started to develop an assessment that clinics could take and resources to go along with that to help them better improve their processes. We've got a lot of those still active on the website that you see on the slide here, healthinsight.org/blood pressure. Many things that we were able to take forth into the community and really help clinics improve the care they were giving and thereby increase their blood pressure control rates. We, as a coalition, put together an award that we called the Excellence in Blood Pressure Measurement and Control Award, and have just been ecstatic at how this has gained traction and increased over the years in people applying and in different levels achieved. It's sort of a it goes from bronze to platinum in levels and points and all of that good stuff. But in applications received, you can see here when we very first started, there were 16, and now just this past April when we wrapped up, there were 133 applicants. We've also been able to see a move in hypertension control rates in that group. In 2017, it was 64%, and in 2018, it was 70%, and we're still calculating, so I'm sorry, I don't have a rate for you for 2019, but we're confident that people have just been doing better and better and improving over the years. And as many of my colleagues have said here today, that we really attribute a lot of that to the partnerships that we have in our community, and not just partnerships with people like our local chapter of American Heart Association, but really with the providers and the clinics and the people on the front lines doing the work and implementing these different things. So a very big thank you to all of you who have participated and worked with us and really dug your heels in to make improvements in your setting. And we look forward to continuing some of this work for the next 5 years. And I'll pass it back to Edie now.
Thank you. I want to thank my colleagues in the other states for all your hard work and dedication to this task. I know certainly hasn't been easy, and we've had our ups and our downs and our transitions and changes. So thank you all for everything that you've done for this work, and I appreciate everything, in addition to all the people who have worked hard on this task. The New Mexico highlight is, for us, we've really worked hard to work with a number of recruited home health agencies to help them reach their milestones, and the vast majority are at mile 3. We have one that's almost to mile 4, but we're not there yet. So we're still working with them, and we will continue to work with them and anyone else who needs our assistance between now and the end of our contract, beginning of the new. We've also worked with the New Mexico Chronic Disease Prevention Council in many areas as well. And I was recently appointed as the chairperson or the chairman to the Heart Disease and Stroke Prevention Subcommittee. So that's more work that Comagine Health is going to get to be a part of on a state level to continue the work that we've been doing. And that brings us back into our sustainability. If you can advance to the next slide, please. Practices and home health agencies can better understand and track data, implement protocols, and improve process for sustained monitoring of accurate blood pressure measurement and management. Partnerships with key stakeholders will maintain blood pressure control as focus areas. Next slide. Opportunities exist to make even greater improvements in blood pressure management and control, such as more emphasis on home self-monitoring, partnering with pharmacy and community health workers for medication management and lifestyle interventions, helping practices adapt to updated hypertension guidelines that may impact reporting and blood pressure rates. And this brings us to what's next. So we're ending this current scope of work and current contract, looking to, we're in the application process with CMS for the 12th scope of work, which will also be another 5-year award. Oops, sorry. Through this task order, CMS projects projects that the QINs, Quality Improvement Networks and Quality Improvement Organizations, will utilize innovation, broad quality improvement initiatives, and data-driven methodologies to achieve 5 broad aims that will cover improved behavioral health outcomes, focusing on decrease of opioid misuse, increased patient safety, increased chronic disease self-management, including cardiac and vascular health, diabetes, and slowing and prevention of end-stage renal disease, increase quality of care transitions, and improve nursing home quality. Next slide. So when it comes to the chronic disease self-management and our cardiac measures, by 2024, help millions of people with the prevention and management of chronic disease by 1, supporting the Million Hearts Initiative to prevent 1 million cardiovascular events, supporting 69,000 Medicare beneficiaries to quit smoking, preventing 25,171 Medicare beneficiaries from developing diabetes, diagnosing and managing 238,464 individuals with chronic kidney disease to prevent its progression or progressing to ESRD, improving diabetes management in at least 238,464 Medicare beneficiaries. And so those are our goals for our targets by the end of 2024. Next slide. So we have priority focus. We're going to be focusing on vulnerable populations and disparities. And the goal is to reduce health disparities in health status and mental health status among adults aged 65 and older who are members of racial and ethnic groups, dual diagnosis beneficiaries, and/or disabled persons. Next slide. Rural health. This refers to addressing the needs and barriers of populations in geographically rural areas by actively including work with healthcare settings and communities in rural populations. Next slide. And this is another area that we really want to do better at focusing on, is ensuring that our patients and family engagement, ensure that patients, families, and caregivers are actively and systematically involved in quality improvement. So at every turn, our focus is to ensure that the patient and the family and the caregiver is involved in how we proceed and how we help them. Patients, families, and caregivers should be empowered to have their stories and learnings incorporated into healthcare change and quality improvement across all aims. Next slide. And this brings us to the end. I want to thank every one of you again for all the hard work that you've done. We will continue to reach out to our partners, stakeholders, and providers in the coming months as we transition to a new scope of work. In the meantime, if you have any needs that come up or questions or anything that we can continue to help you with, please reach out to any of the state leads. We are here as a resource and will continue to be. And if you have any questions, please again reach out to us. There is a link to a survey. If you could fill that out, we would appreciate it. And let us know what you thought of our monthly lands, how we can improve, and what you would like to see in the coming year. Look forward to speaking with you. Take care. Thank you very much.